Well, the Omicron wave sweeping the country, leading to a record number of new cases and really putting a strain on hospitals. To find out the latest information about COVID-19, the rising Omicron variant, and the latest precautions you should take, we are talking to Dr. Kevin DeCoste, Chief of the Division of Infectious Diseases at UConn Health. Doctor, thank you so much for joining us.
Nice to be with you.
So Connecticut's positivity rate well above 20% right now, but is that the true rate of infection, given that right now so many people are taking those at-home tests?
Well, certainly the positivity rate is a number that allows us to track this over time, but with the extensive use of at-home tests, these tests are not getting reported to the state, and so we can assume that there's a large number of folks out there who are testing positive, and really the test positivity rate is just one aspect of the picture. There are certainly many more people who are being tested positive through home testing.
That makes sense. Many people frustrated by the fact that we are still dealing with COVID-19 and also frustrated that the rules about COVID-19 and the guidance seems to keep changing. What do we need to know right now?
Well, the one thing to understand is the guidelines are going to change as we get a better understanding of the virus, and especially as Omicron takes over. Omicron does have slightly different characteristics. So at present, if one is infected or documented to have COVID-19, you should stay in isolation for 10 days. You can break that isolation and come out at 5, especially if you have a negative test. So getting testing, of course, is the challenge.
Now, can these COVID tests actually specify the certain variant you may have? Say, you know you have Omicron or you know you have Delta, and also kind of two parts here. What do you know about the deltachron concern now?
Right. So first of all, the tests that we have are specific to the virus itself, but not to the variant. So you're unable to tell whether this is Delta or Omicron. Now, the state does do testing of a subsample of patients, and it does take about a week for them to come back with the variant. And so we were able to see a community prevalence of Omicron, and Omicron has basically been taking over. Now, this deltachron variant has been described in Cyprus, and we're still trying to figure out what that actually means. It could be something as simple as a laboratory contaminant, or possibly patients who are infected with both variants at the same time. Or it could be a possibility of something called recombination, which is something that viruses do to exchange their genetic information. Really, at this point, it's pretty preliminary, so we'll just have to wait and see how this bears out.
And last question for you, Doctor. Obviously, fully vaccinated still means that you've had 2 doses of either of the mRNA vaccines, or you've had 1 dose of the J&J vaccine, but the booster shot is out there. Despite Omicron being relatively mild for most people, are you still saying to folks, go out and get the booster shot?
Absolutely. So once you're eligible for a booster shot, you absolutely should get that. The protective efficacy for Omicron with a primary series is about 34%, so better than 0, but that can go up to 75% if you get a booster shot. So really, booster shots are highly recommended.
All right, a lot of good information there. Dr. DeCoste with UConn Health, thank you so much for being with us. We appreciate it.
Thank you very much.